am Dr. Gaston Cornu-Labat. For 2 years now, me and my family have been suffering and confronting a bothersome fight that apparently would seem to have ended in our favor on December 12, 2011. However, nothing is further away from reality than this appearance. Starting on July 2009, I brought forward to Quincy Valley Medical Center a series of denouncements after having found numerous serious irregularities, problems and deficiencies within this same hospital, which later were regrettably found also to involve the Department of Health. All of this led to a series of false accusations being raised against me of disruptiveness and disconnection from reality, and eventually to even put in question my medical license. Being said accusations and questionings motivated and pursuant exclusively to deter me from continuing to investigate and denounce issues of concern. Case in point, despite having been there no valid argumentation whatsoever to sustain these presumed doubts and accusations against me and my professional suitability, and to the contrary, being there ample testimonies and proof of the denounced problems, and having I presented to every corresponding authority under the sun ample proof and testimonies of my impeccable professional performance and my high degree of sociability, all of these from colleagues, co-workers, friends, neighbors, and even patients, and lastly through professionals who provided unquestionable reports of multiple evaluations that leave no doubt whatsoever about my perfect mental health status, DOH capriciously and inappropriately remained pig-headedly demanding that I be submitted to new mental evaluations. Being this not enough, DOH embarked in an illegal and never-ending process to impose on me these baseless evaluations. On the other hand, all the denouncements that I brought forward to them, and which possessed solid reason and proof to sustain them, DOH has systematically, to this point, minimized, invalidated, ignored, and even technically tried to refute them. Despite the absolute lack of professionalism displayed by DOH and their marked malicious intentions, I found myself eventually involuntarily forced to have to submit to these evaluations. And even though some DOH authorities and professionals had no option but to confirm what has been obvious all along, that is, exempt me from any doubt or accusation and establish my perfect psychomental status and professional suitability. This is for me and my family a partial victory, since both to me and to my family, nobody will take away the bitter taste and humiliation of having been subjected to an unnecessary, long and torturous process of questioning, doubt, and finally evaluation, which, as mentioned before, has been illegal. In regards to these evaluations, which were carried out by DOH-appointed experts, Dr. Russell Vandenbelt, psychiatrist, and Dr. Kenneth Muscatel, psychologist, and are now public documents, a few points require clarification. Ample evidence highlights the unfortunate attitude and intentions of the psychologist Dr. Muscatel, since despite having him exempted me on December 1st, 2011, of all doubts, accusations, charges, or guilt, through his objective report of the results of the neuropsychological tests, he took the time to make the following regrettable and irrelevant observations, which on top of everything do not contribute to the results of the evaluations other than possibly undermining in a subtle way my psycho-emotional state. In his report, Muscatel clearly established that I present no evidence whatsoever of any neuropsychological disorder, adding, however, that I appear slow and present a marked elevation of persecutory feelings and thoughts, that I appear somehow naive and psychologically unsophisticated, and appear to have hostile feelings under tight control. All this possibly without taking into account or having understood that after having I suffered for so long every sort of unfair retaliation and undeserved adversities as a result of the misuse and abuse of every available technicality with the only goals of wearing me down and subjugating me, my performance with him at these tests is not being slow, but possibly and circumstantially showing some exhaustion, and more than anything, being fearful of being exposed to a new adversity and deceit, and this fear making me act or be very distrustful, which in turn makes me be overly cautious and prudent, all of which, in a very justifiable way, are apt to not allow me to reach the standard levels of response speed established for this type of tests under normal conditions. Maybe what Dr. Muscatel doesn't get is that he's evaluating people and not machines. And furthermore, that this real meat and bones person that is me, through the course of these last 2 years, has never been able to shelter himself behind the peace of mind of a standard situation, since what I had to experience has nothing of the standard and everything of the exceptional, all of which makes my situation not fit at all within the classic common or standard norm. If Dr. Muscatel wants to follow rigid standards, data and statistics without taking into account the context of the circumstances, then I suggest he changes professions and goes to work for GM or GE. Likely he will find there thousands of manuals, tables, statistics and standard measures which he will be able to apply liberally without needing to question or consider more than 1 or 2 parameters or variables at any given time. Continuing with the rest of his report, there can be nothing more inaccurate than considering me unsophisticated and naive, when the reality is that being I immersed in a situation with such rotten smell, it was I who perceived it and who called it as such from the beginning. Lastly, regarding his observation about me presenting a marked elevation of persecutory feelings and thoughts, I tell Dr. Muscatel that he again has missed the mark completely on this observation. There is nothing about feelings or thoughts on my part. I concretely suffered a long and tortuous process of intimidation, harassment, persecution, and attempted subjugation. Now let's see. I wonder if you, Dr. Muscatel, were to bring up issues of concern with concrete evidence to the different pertinent authorities, and these denouncements are neither attended to nor heard, and on the other hand, if your local newspaper lobbies and carries out distortive propaganda, flowering those that have erred, endangering the public for so many years, generating all these a white-gloved cover-up that makes the denouncements more difficult, if you, Dr. Muscatel, have to suffer systematic defamatory campaigns of every sort, false accusations against your personal and your professional suitability, if those who are investigating you refuse to provide you with parts of the investigative files you are entitled to, and know that they contain likely details that put in evidence the slander and spite from these false and malicious accusers, if you are referred to by the authorities and administration at your workplace to the WPHP, the Impaired Physicians Program, with the purported goal of being evaluated in a fair and unbiased way, while in reality this is being done in the most adverse conditions, pursuing the real goal of intimidating, harassing and pressuring you. If then the WPHP sets forward conditions even more adversarial, where they even refuse to respond about the reasons why I had been accused and consequently referred to them. If after repeated requests and inexplicable delays, WPHP answers you that the only accusations and charges against you have been, literally, that you appear to have changed your way of thinking and acting. if WPHP refuses to give you a minimum guarantee for the supposed evaluation process to be carried out in an objective and unbiased way, if on top of everything you get fired with bad faith as a consequence of all this, and you are unable to secure new employment because all this is leaking over everything, being left with no income, homeless, and unable to take care of your family, and having to spend fortunes in your defense, and to preserve the little that is left of your name and reputation. And if after having you been fired, Mr. Meret, QBMC CEO, illegally and inappropriately makes public in the local news your dismissal, and if you, the same as a number of other Quincy citizens, more than repeatedly request accountability from QBMC authorities regarding everything that is going on, and these authorities not only refuse to acknowledge the reception of these requests, but also in some instances refuse to respond, and in some others respond with evasives, and lastly in some others even respond with misrepresentations and lies. And if some of those citizens who are supportive of you and what you're doing are intimidated and even insulted and threatened in public and in private by some of these same QBMC commissioners, and if the QBMC administrator had forced about 150 hospital employees into signing a presumed confidentiality agreement that literally coerced them from contacting you, doing it in the most barbaric, brutal, and even illegal way, and being this a flagrant trampling of people's freedom of expression and constitutional rights. And if also you're accused of being a violent person and a possible physical threat to the community, as Meret did with me, and if an unfounded restraining order is imposed on you, Dr. Muscatel, and if you are illegally arrested, bringing all of these as a consequence, a weakening of your faith in the value of the truth, law, order, authority, and justice. And lastly, if you, seeking protection and justice, self-report to the Department of Health, and this agency neither acts nor responds, and when they do finally act and respond, they do so in the slowest, most evasive, ambiguous, distorted, and inefficient way. And while this unfolds, you confirm that this agency for several years failed to do the required safety inspections at this hospital that is inappropriately, unfairly, and maliciously accusing you, finding out that together both the hospital and DOH have been responsible for jeopardizing public safety and mainly the patient's safety. And after a long game of hide and seek, in the most unprofessional way, using every available technicality to make things difficult, DOH pressures you to get mentally evaluated in their terms without due process, while blatantly ignoring the results of the 4 mental evaluations that you handed over to them at the opening of the case, and that clearly establish your perfect mental health status, pressuring you to get evaluated without giving you a genuine chance to defend yourself or present your case and your witnesses at a hearing. And if all of this is not enough, when you refuse to comply with such unjustified and capricious imposition while demanding explanation and due process, then you're charged with unprofessional conduct for being a disobedient bad boy. And for this charge, you do get a hearing. Although for this hearing, key elements of the file that would prove the lack of grounds to the accusations are withheld from you. And when at the hearing you start pointing out these missing files, the judge abruptly calls for a recess. And after this abrupt recess, then the judge gives no place for your continuing claim of the mysterious missing files. And on top of all of this, at this kangaroo court, your key witness is subjected from giving testimony, being him the expert witness that can testify to the absurdity of the accusations and to your good health and suitability. And finally, if you're forced to submit to unnecessary and unfounded mental evaluations with the department, being discouraged in the most uncomfortable, inappropriate and adverse conditions, and where on top, said process of imposition has been illegal. And furthermore, if your license to practice is illegally suspended. How would you feel, think and act, Dr. Muscatel, confronted with such adversity, such retaliation and gross conspiracy actions? Would you maybe feel and believe that nothing is going on? Or maybe that something is happening, but it is all simple, unfortunate and innocent chance? Would you not maybe feel beaten down, worn out, downhearted, hopeless and sad after such anguishing fight and such prolonged agony? Would you not maybe feel, better said, be fearful, untrusting, doubtful, and confronted with such circumstances? Would you not act with excessive caution and prudence? Maybe you believe that confronting such circumstances, a person could have the same freshness, the same reaction time as a person to whom none of this happened. I believe only a fool, insensitive or demented individual, understanding demented as someone exhibiting cognitive deficits, someone disconnected from the reality of a situation, someone not conscious about the consequences of an action, only such individual could say that none of this can affect any given person. I believe that faced with such brutal exposure, any person would logically succumb to some ailment or even emotionally crack. Going even further, I think this is unfortunately the white-gloved strategy commonly applied by malicious and unscrupulous individuals who, through these mechanisms, hide behind a system that enables authoritarianism and abuse so as to wear down and suffocate through adversity good people that put in evidence wrongdoing by those same who hide behind these mechanisms and systems. Many have been the victims of this type of individuals and of the misuse of power structures in all walks of life. I could have been one more of those victims, and I think I ended up not being one due to my will, my solid convictions, and the support of several people, among them and mainly my family. Faced with such facts and circumstances, as a physician, I would say that it would be unhealthy not to feel intimidated, persecuted, and even attacked. As a physician, faced with such adversities, I categorically affirm that thinking or feeling anything contrary to this, anything different, would be to be disconnected from reality and consequently be insane. Once more, Dr. Muscatel, what you observed as a feeling of persecution on my part has nothing of feeling, since it has all been concrete, long, heavy and painful persecution of me. This is nothing new. Since at closed doors and off the record, in different opportunities, several individuals and authorities within DOH have personally considered to me, after going through the extensive materials in the file, that this is a clearly evident case of whistleblower retaliation. Keep in mind, Dr. Muscatel, that both for you and for the OH, the list of atrocities I just outlined are nothing new, since this list and much, much more are present in the file that so long ago now I personally handed to the OH, starting when, in October 12, 2009, I self-reported this situation to them. Finally, Dr. Muscatel highlighted in his report from December 1st, 2011, that my no-so-quick responses according to the standard tables and my presumed depression could benefit from counseling support or antidepressants, maybe without taking into account that the solution to such presumed state of mind does not come from artificial remedies such as pills, but through giving me back my dignity, my peace of mind and financial self-dependence, and being able to regain my faith and hope in truth, good, authority, law, our Constitution and justice. As I mentioned before, the fact that now the OH had to acquit me of these malicious and unjustified accusations, and consequently on December 12, 2011, minutes after finishing the hearing, officially reinstate my license, I do not consider this a great victory, since putting in doubt my personal and my professional career is something that should have never happened, and reinstating my license is nothing more than what unquestionably had to happen. However, this reinstatement has been one battle, and my fight, which is represented by my alma mater's motto, Certa bonum certamen, fight the good fight, will not conclude until the pending battles are won. And these battles have had and continue to have a very high cost. This Christmas, for the first time in 43 years, I have been far away from my closest loved ones, my wife and my children, my parents and my siblings. On December 12, 2011, who I am as a person and a professional has been well established. What is missing now is that socially and legally this is recognized, and that each one of those that I have accused and denounced are legally condemned. Those who have acted in a negligent, malicious, irresponsible and illegal way will have to confront the consequences of their actions, and will have to repair all the damage that for so long they have caused to so many. Herein lies my good fight, in this and in procuring, together with the efforts and capacity of so many other good people, accomplish something significant with the goal of making these unscrupulous and irresponsible individuals never again have free reins to act in ways that so radically harm so many people and families. Following this introduction, and for your further information, I invite you to see the video recording of my reinstatement hearing that took place on December 12, 2011, and where, after having I been acquitted through the examinations on December 1st and deemed perfectly suited to practice medicine, according to the OH, it was necessary to have this hearing to evaluate the reinstatement of my license, and if so, then decide when the reinstatement would happen. The OH's initial proposition after the results came in on December 1st was to tentatively have this hearing some 6 weeks later. The results of the evaluations, which are public documents, are available for your review through the link
available for your review at www.dohaccountability.org. You will find links to the reports of the investigative medical exams of Dr. Cornu Labat, ordered by the Medical Quality Assurance Commission from the Washington State Department of Health, together with the order for full reinstatement of Dr. Cornu Labat's license that followed the license reinstatement public hearing conducted on December 12, 2011, which is also available for your review through this website. This last hearing would not have taken place had this agency not validated the false accusations raised against Dr. Cornu Labat, or conversely, had this agency appropriately considered the original investigative medical evaluations presented to the QBMC authorities, the WPHP, and the Medical Quality Assurance Commission between September and December of 2009. The reports of these original evaluations are also available for your review through this same website. Finally, you will also find in this website the links to the first public hearing conducted by DOH, where Dr. Kornulavat's license was suspended on April 1st, 2011. And to Dr. Kornulavat's first public denouncement of corruption and abuse of power by these agencies related to the healthcare system. www.dohaccountability.org